Hey Mickey, how are you? Are you ready for a report on patient in room 558? All right, great. So patient is a 50-year-old female, Sandra Smith, date of birth 5/9/69. She was admitted yesterday at 2 p.m. after complaints of persistent cough for 2 weeks, hemoptysis for 48 hours, low-grade fever, and night sweats. Her admitting diagnosis is active tuberculosis. The patient is a full code and has no known allergies. She doesn't have any significant medical history. A CMP, CBC, TB gold blood test, sputum culture, and chest x-ray were performed. The CMP was unremarkable. However, her white blood count is high at 15,000. The sputum culture and the TB gold blood test both came back positive. Her chest x-ray showed abnormalities with cavitations and lesions. Earlier on shift, she had increased respirations at 20, and I started her on 4 liters of oxygen via nasal cannula, and her respirations have since decreased to 16 breaths per minute. After interventions, oxygen saturation went from 94% to 98%. She was tachycardic at 110 beats per minute. However, after oxygen therapy, her heart rate went down to 99 and has been holding steady for about 2 hours. She completed 500 milliliters of normal saline and has voided 2 times with no bowel movement. She is resting comfortably now in a semi-Fowler's position. She is on airborne precautions in a negative pressure room, and the patient and family have both been educated on airborne precautions. The patient is currently able to clear sputum and continues to have a moderate amount of sputum that is slightly blood tinged. Despite my best efforts, she refuses to use a kidney basin to spit in and is instead using a tissue and disposing in the trash. I educated the patient on the importance of monitoring the amount and color of sputum productivity. I have not had to use suction on my shift, however it is readily available. Her family came to visit her once today, and the family seemed very concerned, and they were a bit distant and left shortly after our discussion. I believe she may not have the support system at home she needs. She seems very depressed about her current state, and I've discussed with case management, and they've reached out to the contact on file. From what I understand, the family was not around and they were down vacationing, but I'm unsure if she has anyone local who can assist her upon her discharge. I'm worried about her intake. She did not eat dinner, and the brief conversation I had with her family, she didn't have much for groceries at her home. I don't have a weight on her currently, but I am concerned about adequate nutrition. I did not have time to get a weight, so if you could possibly do that, it may be helpful when we talk to the doctors about possible supplementation. I would keep an eye on her oxygen saturation. She is stable presently. If you want to follow up with case management about her home environment and support system outside of the hospital, I think they may be gone already, but you can pass it along to tomorrow's day shift, and also possibly re-educating her on the importance of monitoring the amount and color of her sputum output.